My name is Fernando. I'm a doctor, an orthopedist, and 11 months ago I was diagnosed with a lumbar herniated disc between the 4th and 5th right lumbar vertebrae, which, within a week caused sensory and motor impairment in my leg, with a dropped foot, an equinus foot, and the inability to lift my foot.
When Fernando came here, he was in a situation that was honestly quite good, in that it had happened a very short time ago, and that also had a big influence on his recovery. It's a peripheral nerve injury that we see quite commonly, but in his case, what specifically made a difference was that he came in very soon. So we were able to take a very early approach using all the tools at our disposal, especially the electrostimulation part, which requires a very specific approach, such as stimulation of the nervated muscles with specific devices for it. Not just any device will work. And also that invasive approach, what we call ultrasound-guided percutaneous neuromodulation, where we go very specifically with an ultrasound guide near the nerve to intervene directly on it, along with other tools for both assessment and treatment, which are and were key, especially in that first part when the patient's condition is so severe. Part of the treatment and assessment in this case is, especially when Fernando started with us, he had a problem with foot drop, which is very common in this type of injury, where the patient doesn't have enough strength to lift their foot. And so it's also very difficult to assess objectively without those specific devices or tools, because if we don't have them, we don't really know if the patient is improving or not. That's why it was very important and interesting to incorporate surface electromyography into the treatment and assessment. When it's not possible to assess muscle strength, because it wasn't possible, there was none, it was a 0. It does give me information about that muscle activity, which gradually improves until a point comes when he is able to lift his foot and gain muscle strength.
I started here, a month after the surgery, and honestly it was, an early and intensive therapy. A month after the surgery, I started doing rehabilitation, 5 days a week for 2 months, 2.5 hours every day. Honestly, I think that was key for my recovery. I can now run on a treadmill at 12 kilometers per hour. I can move my foot. I've recovered mobility in my hip, which I had also lost. I've recovered sensation, and honestly, it's going quite well. I think the most important thing is that it's an individualized treatment. For the first 2 months, for the 2.5 hours, the physical therapist was with me for the 2.5 hours, and for the rest of the months as well. And then, with some therapies that are quite modern and that maybe you can't find in other places, like for example the electrical stimulation with a transdermal needle, which for me I think has been fundamental for my recovery.
Breaking boundaries in neurorehabilitation, changing lives.